Hello and welcome to Health Matters. I am your host, Dr. Michael Chillemi. Well, with Health Matters, we are going to talk about everything that is holistic health. And in today's exciting episode, we're going to dive into not a topic that a lot of people know about. And I have a few patients that with it, and they asked me to really take a deep dive into it. So I'm going to do it for them and for you. So the topic I'm going to talk about today is lymphedema. We're going to cover the common symptoms, the causes, some diagnosis methods, and a variety of treatment options that are available. So whether you or a loved one is dealing with lymphedema, this episode is packed with information you won't want to miss. First things first, what exactly is lymphedema? Lymphedema is a condition characterized by swelling due to buildup of fluid in the body's tissue. It usually occurs in the arms or legs, but can affect other areas as well. This condition is often develops after some lymphatic nodules are damaged or removed from surgery or even during cancer treatment. So, what is lymphatic fluid? I've heard of this. I don't understand it. I don't know what it is. Okay, so let's break it down. The lymphatic system is a crucial part of the body's immune and circulatory system. It consists of a network of vessels, nodules, and organs that all work together to help maintain the fluid balance and protect against infection and removal of waste products from the body. Here is a breakdown of the main components and the function of the lymphatic system. Lymph is a clear fluid that circulates throughout the lymphatic system. It originates from interstitial fluid that surrounds cells and tissues that contains white blood cells, especially lymphocytes. Lymphatic vessels. These are similar to blood vessels, but they are lymphatic vessels, and they transport lymphatic fluid throughout the body. They include a network of capillaries and larger vessels that eventually dump into the bloodstream. Lymphatic nodules. They're small bean-shaped structures located throughout the body. They help filter lymph and are rich in lymphocytes and macrophages that help fight infection. Common areas with clusters of lymphatic nodules include the neck, armpit, and groin. The thymus. It's an organ located behind the sternum that produces T lymphocytes or T cells, which are crucial for the body's immune response. The spleen. It's the largest lymphatic organ located in the upper left quadrant of the body. It filters blood, removes old blood vessels, and helps produce and store white blood cells. Tonsils and adenoids are also located in the throat, and they're lymphatic tissue that helps trap pathogens that enter through the mouth or nose. Bone marrow, soft tissue inside the bone where the blood cells, including lymphocytes, are produced. They help to produce and they help with fluid balance. The lymphatic system collects excessive interstitial fluid from tissues and returns them to the bloodstream, maintaining proper fluid balance in the body. The immune defense. It is a key player in the immune system producing, transporting white blood cells that help defend against infections and diseases. The absorption of fats. The lymphatic system, through structures called lacteals in the small intestines, absorb fats and fat-soluble vitamins from the digestive tract. Waste removal. It helps transport waste products and toxins away from tissues and organs ensuring that they are processed and eliminated by the body. Overall, the lymphatic system is essential in maintaining health by supporting the immune function and ensuring fluid balance and facilitating waste removal. If you have an infection, your lymphatic system is the fighter in it. You will get those nodules in your neck. Some of the symptoms to identifying lymphedema are crucial for early management and treatment. Common symptoms of lymphedema include swelling in part or all of the arm or the leg or your fingers and toes, a feeling of heaviness and tightness, some decreases in range of motion. When you have that extra fluid, you're going to have some decrease in motion, some pain of aching and discomfort type pain, maybe some reoccurring infections, well, hardening of the skin, typically called fibrosis. Common causes of lymphedema can be categorized into two groups, primary and secondary. Primary lymphedema is usually pretty rare. It's usually from genetic factors that are affecting the development of the lymphatic system when you're young. Secondary lymphedema is much more common and typically results from surgery, radiation treatment, or infection or some kind of injury that damaged the lymphatic system. Diagnosing lymphedema typically involves a combination of medical history review, a deep dive into your history, a good physical exam by your physician, and imaging tests. Healthcare providers may use techniques such as we'll see if I can get this word right, lymphoscintigraphy, which is a specialized imaging method to visualize the lymphatic function, and MRI or CT scans to get detailed images of the tissue and lymphatic nodules, Doppler ultrasound to rule out blood clots or vascular issues. What are some of the treatment options that you have if you have lymphedema? Some of the treatments that we can delve into to help manage and treat lymphedema, especially at our center, where we're focused on the integrative, non-invasive treatments to promote healing, and we want to improve the quality of your life. Some of the main treatments that we're going to want to do is manual lymphatic drainage, MLD it's called. So manual lymphatic drainage is a specialized massage technique designed to stimulate the flow of lymphatic fluid and reduce swelling. Manual lymphatic drainage is a gentle massage technique that aims to stimulate the flow of lymph through the lymphatic system, thereby reducing swelling, promoting detoxification, and supporting the immune system. It is often used to treat lymphedema, post-surgical swelling, and chronic venous insufficiency. The key principles of manual lymphatic drainage are gentle pressures, very light, rhythmic, precise movements, because the lymphatic vessels are very superficial to the skin. They're right underneath there. And if you have too much pressure, you can collapse some of these delicate vessels. So you want to be gentle. They are in rhythmic and directional strokes, movements that are typically performed in a rhythmic manner to encourage natural contraction of the lymphatic vessels. The strokes follow the direction of lymph flow, which is generally towards the central lymphatic vessels and nodules, whether it's the arms, the armpit, the neck, or the groin, depending on where you are. Sequence of movements typically follow a specific sequence, starting with clearing the central lymphatic pathways. Typically, the neck and abdomen are first before moving to the extremities, the arms and legs. This helps prevent any potential blockages to ensure effective drainage. So what are some of the techniques? Are small circular motions applied with fingers and hands to stimulate some of these lymphatic vessels and nodules. Pump strokes, kind of like a wave type therapy, which is meant to be, again, in rhythmic, that mimics the natural flow of lymphatic system. So it's a very small, gentle technique. Scoop strokes, gently scooping motions that help move the lymphatic fluid. Rotation techniques, circular motions, again with light pressure. Some of the benefits of utilizing this type of system is to reduce swelling by improving lymph flow. Manual lymphatic drainage helps reduce edema by causing the excess of fluid of tissue to move throughout the body. It's a type of detoxification technique which help aids in the removal of waste products and toxins throughout the body. And as we're doing this, we're going to improve the immune function by enhancing the transport of lymphocytes and other immune cells. This can help actually boost the body's ability to fight infections. Pain relief, due to the gentle nature, manual lymphatic drainage can alleviate some pain from swelling and inflammation and relaxation during this treatment. Enhanced healing from some post-surgical or post-traumatic swelling can be reduced as well. So this has been a manual lymphatic drainage has really helped with some surgical conditions. But specifically when we're talking about the lymph system, we really want to reduce swelling. So by utilizing some of these precise movements and motions, we're going to really help the body's ability to balance out and function with the balance of fluid, help detoxing, and help boost up the immune system's response. It is critical for each person to do their own type of therapy and benefits for them, but this manual lymphatic drainage has been kind of a staple in lymphedema. Some of the other techniques that are used in lymphedema are compression therapy. The use of compression garments, such as stockings or sleeves, helps prevent the fluid buildup. Gentle exercise technique is, and exercises that help promote lymph function and fluid movement is critical. Having proper skincare to prevent infections is also important. Some of the other things, and we have one of these here, low-level laser therapy helps reduce inflammation. So when you're using, especially the laser we have here in our office, we use it it makes the body think you have a type of infection. It helps promote lymphocytes and white blood cells rush to the area when you use low levels. It helps promote flow. Compression devices, such as those pumps that you have for the legs to help fluid go up and down, is another technique you want to use. Kinesiotaping, applying the kinesiotape to different areas to help the body circulate and drain properly. If you can exercise in a pool, that is great for lymphatic drainage. It really helps the body take the pressure off the joints and you get those joints moving in a better fashion. Layered bandaging can help provide pressure and stabilization to some of the lymphatic system, kind of like a compression sock. But when you use certain type of bandaging, you can help tighten those areas up. Sometimes doctors can use antibiotics. They are prescribed to treat and prevent infections that can affect those limbs that you're having the fluid build up. Doctors can also prescribe diuretics. Although typically they don't do it for long-term, it's more short-term usage. It helps reduce that inflammation. Sometimes doctors can utilize pain-relieving medications some NSAIDs to help reduce inflammation that are associated with lymphedema. Recovery and wellness at the Health and Spine Wellness Center is critical. We believe in a holistic approach to healing. Our team of experts will work with you to create a personalized treatment plan that address your specific needs. Beyond conventional treatments, we want to incorporate nutrition guidance, physical therapy, chiropractic therapy, integrative medicine all together to help heal you as the whole patient to increase your overall wellness throughout. If you or you know somebody who is struggling with lymphedema, please don't hesitate, have them reach out to us and we'll see if we can help them in any way possible. Getting the right combination of treatments is critical to improving your quality of life, right? Life is function. So the more you can do, the better you're going to be. Please reach out to our website, healthspinewellness.com, or if you're in the area and you want us to take a look at you and see if we can help you, 973-759-3020. We can help. Remember, it's never too late to start your healing journey. You or know somebody or know a friend, a family member, somebody that can benefit from learning a little bit more about lymphedema, or somebody that wants to just learn about more conditions, please pass this podcast along. Don't forget to subscribe to our podcasts. And I will end it with this. The information that I have provided you today is my opinion and is meant to be as an informational purposes only. It is not meant to be treatment. It is not meant to be a diagnosis. It is not meant to be in lieu of going to see somebody. Please go and see that professional. These opinions are mine and mine alone. And again, it is meant to be for informational purposes. It is your life. Be there healthy. Take the time to understand what you have. Be there healthy because health matters. Till next time, have a great day.